Introduction. Hello everyone and welcome to our channel. Today we will be discussing a very interesting topic which I'm sure a lot of you will find interesting, regardless of whether you have a medical background or not. Today's topic of discussion is going under the knife, the history of surgery. But before we talk about the history of surgery and how it has evolved over the years, let's first unpack the phrase going under the knife, because it's not just some clever surgery pun, although that does help. Going under the knife is an idiom meaning to have surgery or to be going for surgery. The knife, as you might have guessed, signifies the use of standard surgical instruments like scalpels, scissors, or, in olden times, saws. The first surgery. To begin our trip through the history of surgery, let's start with its exact definition. Surgery is a branch of medicine that deals with operating on a body to diagnose, prevent, and cure an ailment. Simple enough, right? Well, where did this start from then? In the early days, and we're talking extremely early, around 7,000 to 10,000 years ago, people across the globe practiced what is now considered to be the first proper surgical procedure, trepanation. It sounds complicated, but it was really a simple process where a hole was drilled into a patient's skull. People from ancient China, pre-modern Europe, and all the way to medieval Africa used this technique, mostly to remove what they thought were evil spirits, but some did in fact use it to treat head wounds. Around this time, there are a few recorded examples of amputations and setting bones, and there is even one specific example of leg amputation, recorded 31,000 years ago in Borneo. During the time of Hippocrates, a famous classical Greek scholar, bloodletting was extremely popular. This practice consists of literally letting blood out of one's body, and many ancient peoples, ranging from the Egyptians to the Mayans and Aztecs, partook in it, believing it to cure infections, strokes, and more. The 1600s. Infections and anesthesia. Now let's fast forward a little bit to the beginning of modern surgery and the time of John Hunter, who, during the 16th century, advanced this field so much that he became known as the father of modern scientific surgery. Hunter revolutionized surgery as a whole and relied only on his own experiments, and was the first to understand the importance of pathology and how vital it was to prevent infection and inflammation after surgical procedures. Fun fact: Hunter's great-grandson, Joseph Bell, was the inspiration for the most famous fictional detective in the world, Sherlock Holmes. What a family legacy. On the other side of the planet, but also during the same time, advancements were being made in another crucial aspect of surgery, anesthesia. Among the kingdom of modern-day Uganda, Africa, Banyoro physicians regularly used banana wine to induce comas in people before going into surgery, a practice that helped women get C-sections greatly. However, because of a number of reasons, among them being the slavery of Africans by the West and the general misconception that Africa was uneducated, this life-saving practice was unknown in Europe, and anesthesia only reached Europeans almost a whole century later. Anesthesia then developed significantly after the invention of ether anesthesia. Following this, Joseph Lister developed Listerism and introduced the idea of removing bacteria from instruments, wounds, and the air above patients. We had found sterilization. This discovery of antiseptics and anesthesia marked the beginning of the era of modern medicine. The 1700s. Cancer and vaccines. Alright, enough about anesthesia before you start sleeping. Moving on to the 18th century, there was a surge in knowledge about anatomy, and more procedures that are common today were first made common globally. To recount them quickly, in 1721 Lady Mary Wortley brought inoculation or vaccination to England from the Ottomans. 1735 was the year in which the first successful removal of the appendix was performed. 1773 saw Bernard Pereyrel treat breast cancer. In 1776 John Hunter, remember him from earlier, pioneered artificial insemination, and towards the end of this incredible century, a vaccine for smallpox was found. The 1800s. Heart and X-rays. Nearly 100 years later, in 1879, the first successful brain tumor removal surgery was performed by William Macewen, launching the field of brain surgery. More than a decade after, arthroplasty, a procedure that replaces joints, was introduced to the world when a German surgeon replaced a knee and hip with ivory. Think of how common it is now for people to get joint replacements, isn't it amazing? And just to top off this century, in 1895 Wilhelm Röntgen discovered X-rays, and in the same year, Axel Kaplan performed the first successful cardiac surgery. Both have transformed the field of medicine, and X-rays are the most common diagnostic tool now, and cardiac operations are as abundant as they are life-saving. The 1900s, blood and transplants. We're moving closer to the present day with the 1900s now. In this century, scientists saw great advancements in the study of blood and cardiology. We discovered the basic blood types, pioneered blood transfusion. Willem Einthoven invented the electrocardiograph. Yep, that's the machine that makes those heartbeat lines we see everywhere now, and even the first successful open heart surgery was performed. Among the greatest and most famous feats in medicine performed in this century was the first ever heart transplant by South African scientist Christiaan Barnard, as the whole world watched. There were also tons more surgeries that are commonplace now that were first attempted, including plastic surgery, kidney and liver transplant, and bypass surgery. The 2000s, technology. With that, we have finally arrived at present-day surgery and the advent of technology which has transformed medicine at a pace unmatched by earlier advancements. Early on in 2001, the Da Vinci surgical system, a system involving robots, was approved by the FDA, and in the same year, a ZUS robotic surgical system was used to perform the first ever remote surgery. You heard that right, a doctor is now able to perform surgeries remotely. Just incredible. Other devices have made the lives of patients and doctors' lives much easier, such as blood pressure or pulse rate monitors, pacemakers, etc. More remarkable inventions include stents, prosthetics, and bionics. It is truly extraordinary to see how far surgery has progressed, going from one-size-fits-all procedures like bloodletting to entirely separate fields dedicated to specific parts of the body. It takes years of study to be qualified to treat something as small as the eye, and things are only beginning to evolve. Every day, many new discoveries are being made with the use of artificial intelligence or AI. Surgeries are now being performed with the assistance of AI-enabled planning to avoid human error, and these systems are used throughout the surgical process, from training to diagnosis to recommending the best post-operation treatment for a particular person. The world is only beginning to see the effects of technology in surgery. Robot-assisted surgery is said to become more common and, in the long term, be outstripped by fully automated robots, including nanorobots for drug delivery and diagnosis. This will greatly reduce the invasiveness of surgery. Along with AI, surgical training will be aided by virtual and augmented reality and also allow surgical experts from all over the world to communicate more effectively. 3D printing on a wider scale will make the production of prosthetics and other surgical tools far easier and more accessible. There is still technology we have yet to see that will possibly make the world a more accessible place, providing cures for diseases that have been untradeable so far, designing the best drugs using improved AI, and making the world a more accessible place for those with disabilities. Who knows? Much more than what we can currently imagine can happen, and the future might exceed all our expectations. And now we come to the end of this video. We hope that you found it helpful and informative, and most importantly, inspiring. If this made you more excited about the future of medicine, do like and comment down below and let us know how much you learned and what you would love to learn further. Do also subscribe to our channel and also make sure to hit the bell icon and stay up to date with our latest videos. Goodbye and stay safe.